Welcome back to Think Like a Nurse. We've reached red flag number 7, our final warning sign in this series, sudden overall deterioration. Sometimes you can't immediately identify one specific abnormal finding. The patient simply looks worse. And as a nurse, that feeling should not be ignored. Let's look at a scenario. You're caring for a 70-year-old patient who was admitted with a chest infection. Earlier in your shift, the patient was awake, answering questions appropriately, eating breakfast, and talking with family. A few hours later, you walk into the room and immediately notice something is different. The patient looks pale and unusually tired. Now is breathing slightly faster, and he is less interested in talking. His hands feel cool. When you ask how he is feeling, he simply say, "I don't feel right. Nothing looks dramatically abnormal yet. But something has changed." This is where clinical judgment becomes important. Don't simply walk away because the patient hasn't specifically complained about severe pain or difficulty breathing. Stop and assess.
Check the patient's vital signs. Assess their airway and breathing. Check their circulation and level of consciousness.
Compare the findings with their previous observations. Look for trends rather than focusing on one number. Ask yourself, what has changed? When did it change? Is the patient getting better or worse? And most importantly, could this be an early sign of deterioration? Sometimes the nurse's first clue is not a monitor alarm, it's observation. It's noticing that the patient doesn't look like themselves. It's hearing a different tone in their voice. It's seeing that they're unusually quiet.
It's recognizing that something is simply not right. That doesn't mean you should panic or make assumptions. It means you should assess and escalate appropriately according to your facility's protocols and the patient's condition.
Remember, you don't need to know the diagnosis before you recognize deterioration. Your job is to recognize the change, gather the important information, and get the appropriate help when needed. So let's review the lesson from all 7 red flags.
Difficulty breathing, sudden mental status changes, chest pain, a sudden drop in blood pressure, sudden or rapidly worsening pain, and finally, sudden overall deterioration.
The common thread is change. A good nurse doesn't just ask, is this patient sick? A good nurse also asks, is this patient different from how they were before? Because sometimes the earliest warning sign is simply noticing that something isn't right. This is Think Like a Nurse. Stay observant, keep asking questions, trust your assessment, and remember, early recognition can lead to early intervention. I'll see you in the next episode.